applied nutrition and dietetics. Look at this picture, shows that fats, rich food items, butter, oil, nuts, avocados, meat, and chocolates. A detail going on. Contents: 1. Introduction, 2. Classification, saturated, unsaturated, 3. Calorie value, 4. Functions, 5. Dietary sources of fats and fatty acids, 6. Fat requirements RDA, 7. Application and implication to nursing, 8. Conclusion. Introduction. The study of fats in applied nutrition and dietetics for nursing focus on understanding the vital role of dietary fats in maintaining health, providing energy, and supporting cellular functions. It involves exploring the different types of fats, their sources, and the impact of their consumption on various health outcomes. Nurses learn to apply this knowledge to create balanced dietary plans that promote optimal health and prevent disease. Definition for fat. Fat is a macronutrient essential for energy storage, insulation, and protecting vital organs. It comes in various forms including saturated, unsaturated, and trans fats, each with different effects on health. 2. Classification. Fats are classified into two main categories based on their chemical structure. 1. Saturated and unsaturated fats. Here is a detailed look at each types. 1. Saturated fats. Saturated fats are fats that have no double bonds between carbon atoms in their fatty acid chain. As a result, they are saturated with hydrogen atoms. Here are the key details. First, structure. Saturated fats have straight chains, allowing them to pack tightly together. This tight packing causes them to be solid at the room temperature. Sources. Common sources including animal products such as meat, butter, cheese, and dairy products, as well as some plant oils like coconut oil and palm oil. Health impact. High consumption of saturated fats is linked to increased level of LDL, low density lipoprotein, cholesterol, in the blood, which can lead to a higher risk of heart disease and stroke. However, recent research suggests that the health impact may vary depending on the various dietary context and individual health status. Second, unsaturated fats. Unsaturated fats contain one or more double bonds in their fatty acid chains, causing bends or nicks in their structure. They are further divided into monounsaturated and polyunsaturated fats based on the number of double bonds. First, detail about monounsaturated fats. Structure. Monounsaturated fats have one double bond in their fatty acid chain. Sources. Common sources including olive oil, canola oil, avocados, nuts such as almonds, cashew nuts, peanuts. Health impact. Monosaturated fats are known to improve blood cholesterol levels, reducing the risk of heart disease. They can also help control insulin and blood sugar levels. Then detail about polyunsaturated fats. Structure. Polyunsaturated fats have two or more double bonds in their fatty acid chains. Sources. They are found in high amounts in fatty fish such as salmon, flesh seeds, chia seeds, walnuts, vegetable oils like sunflower and soya bean oils. Health impact. Polyunsaturated fats are essential fats, meaning the body cannot produce them, and they must be obtained through the diet. They include omega 3 and omega 6 fatty acids, which are crucial for brain function, cell growth, and inflammation regulation. These fats are associated with a low risk of heart disease and reduce inflammation and improved brain health. Other type or classification, trans fat. Though not part of primary classification, trans fats deserve mention due to their significant health impacts. Structure. Trans fats are a type of unsaturated fat with at least one double bond in trans configuration, which makes them behave more like saturated fats. Sources. They are primarily found in partially hydrogenated oils, which are used in many processed foods, margarines, and black goods. health impacts, trans fats are considered harmful as they increased LDL cholesterol while decreasing HDL, high density lipoprotein cholesterol, raising the risk of heart disease, stroke, and type 2 diabetes. Due to this risk, many countries have regulation to limit or ban their use in food products. Understanding these different types of fats and their effects on health is crucial for making informed dietary choices and promoting overall wellness and well-being. Three, calorie value. Detail going on. Fats are a dense source of energy in the diet, providing a significant amount of calories compared to carbohydrates and proteins. Here is detailed explanation on the calorie value of fats. Calorie value of fats, energy density. Fats provide 9 calories per gram, which is more than double the calories provided by carbohydrate. It's only 4 calories per gram, and proteins 4 calories per gram. This high energy density makes fats an efficient form of energy storage in the body. Comparison with other macronutrients, the calorie contents of fat is significantly higher than that of other two macronutrients, making it a crucial component for meeting the body's energy requirements, especially during period of increased energy expenditure or limited food availability. Importance of calorie contents in diet. First, energy source. Due to their high calorie contents, fats are an important energy source, particularly for activities that requires sustained energy over time, such as endurance sports. Second, satiety and palatability. Fats contribute to the feeling of fullness after meals and enhance the flavor and texture of foods, making them more palatable. Three, nutrient absorption. Fats are necessary for the absorption of fat soluble vitamins A, D, E, K, and other fat soluble nutrients, which are essential for various bodily functions. Daily caloric intake from fats. Recommended intake. Health guidelines suggested that 20 to 35% of total daily calories should come from fats. This percentage can vary based on individual health goals activity levels, and specified dietary needs. For a standard 2000 calorie diet, this equates to about 44 to 78 grams of fat per day. Balancing fat types, it's important to balance the type of fat consumed. Emphasizing unsaturated fats, monounsaturated and polyunsaturated fats. Oversaturated and trans fats can contribute to better health, heart health, and overall wellness. Metabolic considerations, storage and utilization. Excess dietary fat that is not immediately used for energy is stored in adipose tissue. During periods of fasting or increased energy demands, the stored fats can be mobilized and used for energy. Efficiency. The body efficiently stores fats due to their high caloric density. This efficiency is beneficial in times of food scarcity but can contribute to obesity and related health issues. When caloric intake consistently exceeds expenditure, understanding the calorie value of fats is essential for managing dietary intake and ensuring a balanced and nutritious diet. It also highlights the importance of choosing the right type of fats to promote health and prevent diseases. 4. Functions of fat. Fats play several vital roles in the body, contributing to overall health and well-being. Here are the key functions of fat. First, energy source. Primary energy reserve. Fats are the most energy dense macronutrient, providing 9 calories per gram. They serve as a significant energy reserve stored in adipose tissue and mobilized when the body needs extra energy. Sustained energy. Fats provide a long lasting energy source, essential for prolonged physical activities and during period of fasting. 2. Structural components. Cell membranes. Fats are crucial components of cell membranes, particularly phospholipids and cholesterol, which help maintain membrane fluidity and integrity. Nervous system. myelin, the insulating layer around the nerves fibers, is rich in fats, ensuring proper nerve transmission and function. Three, insulation and protection, body temperature regulation, subcutaneous fat acids as an insulator, helping to maintain body temperature by reducing heat loss. Protection of organs, visceral fat gaseons, and protects vital organs such as the heart, kidneys, and liver from physical shocks and injury. For absorption of fat soluble vitamins. Vitamin absorption. Fats are necessary for the absorption and transportation of fat soluble vitamins A, D, E, K. These vitamins are essential for various bodily functions including vision, immune function, blood clotting, antioxidant activity. By hormone production, steroids hormones, fats are precursors to steroid hormones, including sex hormones, estrogen, progesterone, testosterone, and adrenal hormones, cortisol, aldosterone, regulatory roles. These hormones regulate a wide range of physiological processes such as metabolism, immune function, and reproductive health. Six, cellular functions. Signal transduction. Certain fats like omega 3 and omega 6 fatty acids are involved in cellular signaling pathways, influencing inflammation, body pressure, and other critical physiological responses. Gene expression. Fatty acids can affect the expression of genes related to metabolism, inflammation, and cell growth. 7. Source of essential fatty acids. Omega 3 and omega 6, these essential fatty acids cannot be synthesized by the body and must be obtained through the diet. They are crucial for brain function, normal growth and development, and inflammatory response regulation. 8. Enhancing food flavor and satiety. Palatability. Fats improve the taste and texture of foods, making them more enjoyable to eat. Satiety. Fats contribute to the feeling of fullness after meals, helping to regulate appetite and prevent overeating. 9. Role in reproduction and growth. Development. Fats are vital for the growth and development of infants and children, particularly for brain development and the formation of neural connections. Reproductive health. Adequate fat intake is necessary for reproductive health and fertility, and fats influence hormone levels and menstrual cycles. Understanding these functions underscores the importance of fats in the diet, highlighting the need for balanced consumption to support overall health and prevent disease. Five dietary sources of fats and fatty acids. Detail going on. Dietary fats and fatty acids come from a variety of sources, each contributing different types of fats that play specific roles in health and nutrition. Here is a detailed look at the sources. 1. Saturated fats. Sources: animal products, meat, including beef, pork, lamb, butter, cheese, cream, and other full fat dietary products. Plant based sources: coconut oil, palm oil, etc. Health notes: while necessary in small amounts, high intake of saturated fats is associated with increased LDL cholesterol levels and a higher risk of heart disease. Second, unsaturated fats. A. Monounsaturated fats. Sources: oils, olive oil, canola oil, peanut oil, sesame oil, nuts and seeds, almonds, peanuts, sesame seeds, avocados, a rich source of monounsaturated fats. Health note: monounsaturated fats can help improve blood cholesterol levels, reducing the risk of heart diseases. B. Polyunsaturated fats. Sources: oils, sunflower oil, corn oil, soybean oil, nuts and seeds, walnuts, flax seeds, chia seeds, pumpkin seeds. Fatty fish: salmon, trout, herring. Health notes: polyunsaturated fats include essential fatty acids such as omega 3 and omega 6, which are crucial for brain function, cell growth, and inflammation regulation. 3. Omega 3 fatty acids. Sources: fatty fish, salmon, mackerel, sardines, trout, herring. Plant-based sources: flax seeds, chia seeds, hemp seeds, and walnuts. Oils: flaxseed oil, soybean oil, and canola oil. Health note: omega 3 fatty acids are anti-inflammatory and support cardiovascular health, brain function, and overall cellular function. For omega 6 fatty acid sources: oils, corn oil, sunflower oil, soybean oil, and safflower oil. Nuts and seeds: sunflower seeds, pumpkin seeds, and walnuts. Health notes: omega 6 fatty acids are essential for growth and development. However, an imbalance with omega 3 intake can lead to increased inflammation. 5. Trans fats sources: processed foods, margarine, shortening, commercially packed goods, cakes, cookies, fried foods, snack foods. Partially hydrogenated oils: these are found in many processed food. To extend shelf life, health note: trans fats are harmful as they raise LDL cholesterol and lower HDL cholesterol, increasing the risk of heart disease and stroke. Many countries have regulations to limit or ban trans fats in food. Six. Cholesterol sources: animal products, example particularly the yolk, meat, poultry, fish, shellfish, and dairy products. Health note: cholesterol intake should be monitored, particularly for individuals with certain health conditions, but dietary cholesterol has a smaller impact on blood cholesterol levels than previously thought. 7. Conjugated linoleic acid, CLA sources: meat and dairy, beef, lamb, dairy products from grass fed animals. Health note: CLA has been associated with various health benefits, including improved body composition and reduced risk of certain diseases, although more research is needed. A balanced diet should include a variety of fats, emphasizing unsaturated fat, both monounsaturated and polyunsaturated, while limiting saturated and trans fats. Incorporating diverse sources of fats ensure an adequate intake of essential fatty acids and supports overall health. 6. Fat requirements, RDA. The recommended daily allowance for fats varies depends on age, sex, and overall health. However, there are general guidelines and recommendations provided by health organizations such as the Institute of Medicine and the Dietary Guidelines for Americans. Here is detailed look at the fat requirements. General recommendations. Total fat intake. It is recommended that 20 to 35% of total daily calories should come from fats. For a standard 2000 calorie diet, that equates to about 44.78 grams of fat per day. Specific guidelines by age and sex. Infants 0 to 12 months. About 30 to 40% of total calorie from fat due to their high energy needs for growth and development. Children 1 to 3 years. 30 to 40% of total calories from fat. Children 4 to 18 years, 25 to 35% of total calories from fat. Adults 19 years and older, 20 to 35% of total calories from fat. Men typically closer to 20 to 35%. Women typically closer to 20 to 35%. Types of fat RDA. Saturated fat less than 10% of total daily calorie should come from saturated fat. This equates to less than 22 grams per day for a 2000 calorie diet. Trans fat. Intake of trans fats should be as low as possible. Many guidelines recommended avoiding trans fats altogether due to their harmful health effects. Mono, unsaturated and poly unsaturated fats. These should make up the majority of total fat intake. There is no specific RDA for these fats, but they are considered beneficial for heart health. Essential fatty acids, omega-3 fatty acids. The IOM recommends an adequate intake AI of alpha linolenic acid for adults. Men 1.6 grams per day. Women 1.1 grams per day. Pregnant women 1.4 grams per day. Lactating women 1.3 grams per day. Omega-6 fatty acids. The IOM recommends an AI of linoleic acid for adults. Men 17 grams per day. Women 12 grams per day. Pregnant woman 13 grams per day. Lactating woman 13 grams per day. Considerations for specific populations, athletes and active individuals may require a higher fat intake to meet increased energy demands. Individuals with certain health conditions, those with heart disease, high cholesterol, and other health conditions may need to adjust their fat intake, focusing more on unsaturated fats and limiting saturated and trans fats. Practical tips for meeting fat requirements. First tip, balance and variety. Incorporate a variety of fat sources including fish, nuts, seeds, avocados and plant oils. Second, read labels. Check food labels for fat content and avoid foods higher in trans fats. Three, cooking methods. Using healthy cooking methods such as packing, grilling and steaming instead of frying. By following these guidelines, individuals can ensure they are meeting their fat requirements while promoting overall health and reducing the risk of chronic diseases. 7. Application and implication to nursing. In nursing, understanding the application and implication of fat is crucial across various aspects of patient care and health promotion. Here are 12 key applications and implications of fat in nursing practice. 1. Nutritional assessment and counseling. Nurses assess patients' dietary intake of fats to ensure they meet recommended guidelines and educate them on healthy fat choices. Second, cardiovascular health. Educating patient about the impact of saturated and trans fats on cholesterol levels and heart disease risk helps in promoting cardiovascular health. 3. Weight management. Nurses play a role in educating patients about the calorie density of fats and their contribution to weight gain or loss. 4. Wound healing. Adequate dietary fat intake support skin integrity and wound healing, particularly in patients with pressure ulcers or surgical wounds. 5. Medication administration. Some medications require fat intake for absorption, example fat soluble vitamins. A nurse ensure patients understand these requirements. 6. Diabetes management. Fat influence, insulin sensitivity and glucose metabolism. So nurse educate patient with diabetes and balancing fat intake with carbohydrates and protein consumption. Seven, geriatric care. In older adult, fat intake may need adjustment due to changes in metabolism, health conditions such as osteoporosis and cognitive decline. 8. Pregnancy and lactation. Nurses provide guidance on essential fatty acids during pregnancy and lactation for fetal development and breast milk quality. 9. Pediatric nutrition. In pediatric nursing, ensuring proper fat intake is essential for growth, brain development, and overall health in infants and children. 10. Critical care. Monitoring and adjusting fat intake in critically ill patients to support energy needs, prevent malnutrition, and enhance recovery. 11. Mental health. Omega-3 fatty acids are implicated in mental health, and nurses may educate patients on their potential benefits for mood disorders such as depression. 12. Patient education. Overall, nurses play a pivotal role in patient education regarding dietary fats, ensuring patients understand the importance of choosing healthy fats and avoiding harmful fats for optimal health outcomes. By integrating knowledge of fats into nursing practice, nurses can effectively promote health, prevent disease, and optimize patient outcomes through personalized nutrition, education, and care planning. 8. Conclusion. In conclusion, understanding the role of fats in applied nutrition and dietetics is essential for nursing practice, enabling nurses to promote optimal health outcomes through informed dietary interventions. By emphasizing balanced fat intake, considering individual patient needs, and integrating evidence-based recommendations, nurses play a crucial role in supporting patients' nutritional health and overall well-being. This knowledge equips nurses to address diverse patient populations effectively, fostering sustainable dietary habits and preventing nutrition-related health complications. Thank you. Have a nice day.